PCOS and HTN, or we can also call it as hypertension in medical terms. In normal language or normal vocabulary, we call it as high blood pressure. So let us see how PCOS affects this high blood pressure, causes it or maintains it. What is hypertension? Hypertension is also known as high blood pressure. It is a medical condition where the force of the blood against the artery wall is consistently too high. So I think there is a lot of medical terminology. So let me break down to you so that you can understand what is blood pressure and what is high blood pressure and what is low blood pressure and how is this blood pressure causing or how do you measure it. So as you can see, this is the heart, right? So whatever vessels which come from the heart, okay, vessels which are coming from the heart are known as arteries, and vessels which are going to the heart, okay, they are going to the heart are called as veins. Arteries take blood from the heart and supply it to the organs, or as we can say body, and from the tissues again it gets back to the veins and the veins take it to the heart. This is the normal blood circulation that happens inside our body. Okay, the heart pumps blood, right? Whenever the pumped blood is hitting the wall of the artery, the pressure with which or the force with which the blood is hitting the artery wall is called as blood pressure, right? Then we have two kinds of major conditions in blood pressure, which is called as high blood pressure or HTN and low blood pressure. Okay, so what happens today? We are going to only discuss about high blood pressure. So how do you know if you're suffering from high blood pressure? For example, if you're a person who is aged at around 30 years old or 40 years old and your blood pressure while being monitored is consistently, that is consistently for a week after being monitored, it between different times of the day, your blood pressure is consistently high. What do you mean by high? It is more than the average. What is the average? The average is 120 by 80, right? You can plus or minus 10 in this one, that is it can be 70 also. This you can plus or add minus or add 10, like it can be 130 or it can be even 110. Not it will not make much of a problem. But when your blood pressure is 140 or 150, it is more than 140 and consistently the lower one, this upper one is called as systole, the lower one is called as diastole. Okay, the systole, if it is raising to a little bit 10 or 20, we can manage it. But if the diastole is rising, then that is something that you have to be worried. If the diastole is more than 85, that is it is hitting 90 or more than 90. If the consistent blood pressure is 140 to 150 with the diastole with 90 or more, then that is called as hypertension. More than 140 by 90 mm of Hg consistently for a week, then that you count it as hypertension. What if you are aged around 60? This calculation is for 30, right? What if you are aged around 60 or 70? What if you are aged around 55? Is this the normal blood pressure? Then see, whenever you are counting blood pressure, if you are under the age of 50, then 120 by 80, right? But if you're measuring it after 50 years old, then as I told you, blood pressure is by two things, which is the systole and the diastole. Diastole at any age cannot be more than 85. Okay, given time at any age cannot be more than 85 or 90. But if it is hitting 90, then that means you are hypertensive. But systole, there is a change, there is a calculation. What is it? If you are after 50, then 90 plus your age. If you are 50, then 140 by 80 is normal, right? If you are aged around 80, then 90 plus 80, which is 170 by 80 or 70 is considered a little normal, or it can be normal. Why? Because your systole will increase with your age after 50, but the diastole should not be increasing, right? So this is the whole calculation of blood pressure. So if your blood pressure is more than your age, for example, if you're 50 years old and your blood pressure is at around 150 and the diastole is 90 or 85, you are hypertensive in nature. This is a very simple calculation, but remember, when you're measuring blood pressure, there are two things to be noted. One is the activity. For example, if you have done some activity or coming and measuring your blood pressure, it will not be the normal blood pressure that you're experiencing. Second thing, if you're anxious or if you're stressed out about something and you're measuring your blood pressure, then that will also not count for your normal blood pressure. And the third thing that you have to understand, lying down and checking your BP is considered right. And the fourth thing that you have to understand is that measuring with the mercury sphygmomanometer will give you a proper reading rather than measuring it with an electronic device. If the company is really nice, or if the company has undergone certain trials properly, then you should understand plus or minus 5 changes can happen. But if you are using a company which does not have proper clinical trials on its device, then the blood pressure difference can be up to 10 to 20 in some electronic devices. So I would advise you to check it with the mercury sphygmomanometer. And there are different ways of measuring blood pressure also, but the common way is using a stethoscope and checking the pulse of the person by where the the cuff of the BP machine is tied and is inflated, right? Here Fidicus homeopathy is the best option in homeopathic field. So here we have two kinds of consultation options. So one is the online consultation, the second one is the offline or the in-person consultation option. In person, if you're staying nearby the nearest branch of Fidicus, you can come and contact us. And then if you're staying far away from us, you can contact us online, either through audio consultation option or through the video consultation option. And after the doctor consultation, after your investigations are verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. Staying in USA, 3 to 5 business days. Apart from that, across the globe, anywhere, 4 to 8 business days for our medicines to reach your doorstep. If you want to get in touch with us, you can call us on this number, WhatsApp us, or message us on this number. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. We have understood how homeopathy is the best choice for lifestyle disorders, right? And why should you be choosing Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First, we are experiencing high success rate in cases where there are endometriosis, where there is adenomyosis, where there is PCOD, PCOS, where there is bulky uterus, fibroids, Nebotian cyst, Bartholian cyst. We have other kind of female cervical erosion. All of these cases have high success rate. Second thing, the transparent treatment. There is no gray area between the patient and the doctor. The treatment option as well as your prognosis will be clearly explained to you. Third thing is the personal care, which is top notch at Fidicus. Any sort of queries, any sort of doubts that you are having, you can express it to us and we will be answering and busting all of your myths and queries. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy.
Fidicus Homeopathy.